Culture Council, and our host today and main point person on this whole project is Gabe Pollock, who's our program coordinator and research lead. And then just before we do anything else, I want to give a shout out to Emily Martin and her crew with the Performing Arts Recovery group, and the folks at Matt and Keith at the Public Health Unit, who everybody's worked really hard to put this event together. Before we go any further, I'd like to do the territorial acknowledgements and acknowledge that all of us are gathered here today on Treaty 20 Mississauga territory in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations. Those include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and the Georgina Island First Nations. We want to all respectively acknowledge that the people of the Williams Treaties First Nations are and have been the stewards of this lands from time immemorial. They are the caretakers of the lands and the waters, and they continue to maintain this responsibility, and we are committed to joining with them in that and in respecting all of our work and continuing all of our work on the process of truth and reconciliation. With that said, I'm going to just quickly turn it over to Gabe again to see if there are any other housekeeping notes.
So just want to let people know again, we encourage everyone to stay on mute during the webinar, as this thing kind of makes things a bit easier. We've tossed a copy of the agenda in the chat. There's a link to a PDF, and then Keith also copied and pasted everything. We're going to have a couple presentations, and then there's going to be time for questions afterwards. We've got a couple questions that were submitted via email. And if you have anything else, please drop those questions in the chat and we will get to them. Also, this meeting is being recorded, so we will find a way of making a recording available afterwards for people who want to go back and cross-reference it, or for people who can come here. I think that is everything. And so I think if I look next on the agenda, I think we're moving things over to Keith.
No, actually, Gabe,
Mm-hmm.
I'd like to go around and do the introductions.
Okay.
These Zoom meetings are a great opportunity for people who often don't meet each other or haven't been able to bump into each other recently. So just wondering if I can get the gallery picture back. There we go. And just ask everybody to introduce themselves very quickly, their position and what organization they're representing. And if you would and could, change the name, your name, if you go into, I'm trying to remember if it's participants or, God, you'd think I'd remember. I've been on 400 of these things. Put your correct title and name in your naming on your photo. So maybe we'll start with you, Matt. Maybe Matt.
Hello. Yeah, oh. I'm here. My name is Matt. I'm a public health inspector with Peterborough Public Health.
Keith?
I work with Matt. I'm working remotely right now in the county of Peterborough. I'm Keith Beecroft, and I'm a health promoter with Peterborough Public Health.
Thanks, Keith. Emily?
I'm Emily Martin. I'm the general manager at Showplace Performance Center.
And Peg McCracken?
Peg McCracken, business manager for the 110 Voice Peterborough Singers Arts Group in town.
Okay, Jay?
Hey everyone, my name is Jay Adam. I'm the festival director for the Reframe Film Festival.
Bill?
Yeah,
there you go.
I'm Bill Kimball. I'm the executive director for Public Energy Performing Arts. And I'm also the chair of the Electric City Culture Council board.
And Jay Rees. You're muted, Jay.
Sorry, I'm Joe Rees. I'm
sorry.
development officer with Peterborough and the Kawarthas Tourism and Peterborough and the Kawarthas Economic Development.
Oh, great to have you aboard. Thank you.
Thanks,
Chad.
Sue.
Yes, I'm John Topic. I'm president of New Horizons Bands.
Hi, John. Hermione?
Hi, I'm Hermione Riverson, and I'm a storyteller with the Peterborough Storytellers.
Kate?
I'm Kate Story. I'm with a number of organizations, but I guess primarily today I would say Theatre Trent and also the Theatre on King.
Excellent. Right down from our office when we have an office.
Michael?
I'm Michael Newnham. I'm the music director of the Peterborough Symphony.
Welcome, Michael. Ken?
I'm Ken Abraham. I'm the manager of the Peterborough Concert Band.
Hi. I have SM Quinlan. Not sure. Oh, there we
With
go.
Peterborough and the Kawarthas Tourism and Economic Development.
What's your first name? Sorry.
Susan.
Hi, Susan. You have a great
Hi.
name. Jim Mills.
Hi, I'm from St. James Players. I'm the vice chairman.
Oh, nice to meet you, Jim. Is that everybody? Is there anyone else?
Miss my chairman, Fred.
Oh my God, the most important person of all, Paul.
No, not the most important, but first of all, thank you for the invite. It's a pleasure to join everyone. And I guess my capacity, the reason I'm here today primarily is not only an interest, but I'm the incoming board chair for Peterborough Music Fest. And obviously what's going to be discussed today will potentially have some impact on that event.
Understand. Thanks for being here. Monique? Okay, is there anyone else we've missed?
Fred Batley. I'm the chair of St. James Players.
Hi, Fred.
Hello.
I think Monique had put up a little sign saying she didn't have a mic.
Okay, anybody know who Monique is with?
Monique Renaud, and I'm the general manager at Globus Theatre and Bob Cajun.
Oh, wonderful. Welcome, Bob Cajun. Okay, so we're going to turn it over. Sorry?
I'm Wayne Bonner, and I'm the
Wayne.
vice chair of the board of directors at Showplace Performance Center.
Hi, Wayne. Thanks for being here. Okay.
General Manager, Market Hall.
Hi, Chad. If that is everybody, I'd like to welcome now Kevin from the Peterborough Public Health Unit, who's worked with us on this project all the way along, and I know has lots of experience, not only in this area, but in doing these webinars. And take it away, Kevin.
Terrific. Thank you for having us. It's really great to see so many community partners, and we really value the opportunity, I think, to have kind of that phone tree approach where you're here representing your agency, and hopefully you can take that information back. And when you do have other questions, by all means, please look us up. We've done the introduction, so I'll just skip right over to this piece here. I'm glad that it's being recorded for all of those reasons, such that people that aren't here can get that, and then we can look at about how good we looked when we go back and look at this for posterity. The caveat here, the second bullet, that everything is valid as of this morning. And I say that based on a few different factors. The first one being that last week, Premier Ford said that there weren't going to be any more easing of the restrictions for the better part of a month. I think he gave a 4-week timeline before the regulations were looked at again. And I think that just recognizes that so many things are starting up again, whether it's sports and recreation or school or groups like this. And with all of those new startups comes potential for different case numbers. So I think they put a pause on easing the restrictions for the time being. That's the first caveat. The second caveat is that as we're doing this one, I know that Premier Ford is having a press conference where they are going to be talking about indoor and outdoor gathering restrictions. From what we've been able to glean from media reports, it looks like it's going to apply to the GTA primarily and Peel region and Ottawa Public Health area. So not Peterborough Public Health at this time, though that's subject to change. And I guess everything that we know right now is also subject to the regulations as they're in place, but we know that there are other advocacy groups working with Queen's Park to see about getting the regulations potentially changed or eased or loosened, if you will. So with all of that said, as of this morning, if not right now, the info that we're going to give you is as accurate as we know. We just want to remind folks that we do our best to make sure that you guys get the info, but there is some onus on you guys to make sure that you're aware of what those rules and regulations might be, and we're happy to share that with you when the changes happen and answer any questions. As great as I am, and Matt's even better, but this is really just education. We're happy to interpret the regs as best we can, and our manager's been through it, but it's really not meant to be legal guidance. For that, we would direct you to your own insurance providers or your own lawyers if there's questions that are beyond the scope. And just also recognizing that it's the region of Peterborough City and County and the 2 First Nations in the area that this information is intended for. And that's simply because each region has approached the pandemic in slightly different ways. There's obviously the regulations that we'll speak at length about today, but each health unit, Peterborough Public Health included, has some own rules with regards to masking and group size and those types of things. So if you are coming to us or watching this recording from outside of our area, we would direct you kindly to the public health unit in your area. So with all of that said, perhaps we'll just jump in and kind of give you a bird's eye view of what it is that we're going to be chatting about today. You'll remember, I think it's been 188 days since March 13th when the kids had their last day of school before the March break. March 13th was the Friday when there was a lot of mumblings and murmurings and not sure what was going to happen. And on March 17th, 4 days later, the state of emergency was declared, and that's when the emergency orders came into place. Since that time, on July 27th, the emergency orders were lifted, understanding that the province can't operate under the state of emergency forever. But that said, most of the rules and regulations that were put in place were then transferred to what we're calling Ontario Regulation 364/20. So it's basically all of the same rules and regulations that were captured under the emergency order, but now they're just captured under, I believe it's called the Safely Reopening Ontario Act or something similar to that. And the regulations set forth there is what we've come to know in terms of face coverings and lineups at grocery stores and all of those types of things. So we'll go into depth a little bit there, paying specific attention to Section 11, which is the Performing Arts section, and answer some of the questions that you guys might have from that. So with all of that said, there's this great quote from Michael Leavitt, who was the former Health and Human Services Secretary. I believe it was in one of the Bush eras. And basically his whole notion about pandemics is that everything we do before a pandemic will seem alarmist. Everything we do after will seem inadequate. And I think we've seen a lot of this in terms of whether or not we're shutting down early enough or too late, and people get all up in arms about a variety of things for lots of valid reasons. But we just want to put this notion in that all of the things that we're doing right now are done with the notion and the idea that we're going to be protecting health and humans and lives and livelihoods and all of those things. So while we walk through the regulations, just to keep in mind that it might seem like it's over the top, but really, 3, 4, 5 years when we reflect back on this, we'll go, wow, could we have done anything else? And in chatting with Sue and Gabe, we really understand that it's the peace of mind that we're hoping to be able to sell today as well, so that you guys as operators of venues and representatives for a variety of organizations can have the skills and tools and resources such that you're confident that you can open your establishment safely, so that in the long run, your customers and clients and guests and patrons will feel comfortable and safe coming back, because largely we've created a safe environment. When we talk about health, I just want to preface it by saying that by all means, we certainly do talk a lot about coughs and colds and fevers and migraines and pink eye and all the different symptoms that go along with experiencing COVID-19, which of course are very serious. But we want to be grounded in the fact that at public health, specifically in Peterborough, though not explicitly, when we talk about health, we're talking about the intersection of physical health and mental health, and that you can't have one without the other. To paraphrase a little bit, when we do our work in elementary schools and even high schools, we talk about the coconut and the coconut tree. And if you want to have a healthy coconut, you have to have a healthy coconut tree, and vice versa. So really trying to recognize that when we do talk about health today, we certainly are talking about mental health as well. And really, really recognizing that art and expression and creativity and all of those wonderful things that you guys all know so much about can lead to so much positive mental health as well. Just as an aside, we've done some really neat work with Jenny at the art school. So coming from somebody that used to do tobacco use prevention, I certainly value the role that arts and artisans and the creative community plays in getting people involved in that messaging. So without further ado, what we thought we would do is just run through kind of the basics of 364/20. Walk through, I talked at the beginning a little bit about how there's a certain onus on tour operators or venue operators to understand what the laws are. So we'll walk through the ones that make the most sense. We've cherry picked for a certain amount. Obviously, we're not going to be speaking to the ones about funerals and those types of places. So we've really pulled out the ones that we feel apply most to a performing arts center or artisans as a whole. And I think this one really speaks to exactly that just over the top, public health is here to guide, we're here to direct, we're here to inform. If we have to, we'll enforce. That's not typically our approach in Peterborough. Typically, we'll do the education and awareness first. Although that said, there are tools that Matt and some of his colleagues have to do that enforcement side of things. But really, at the end of the day, we really want to work with you guys. Consider us as consultants, if you will, to make sure that you're getting the information that you need and that you're able to interpret the laws in such a way that makes sense for your specific venue. The way that the laws are written for lots of reasons is that they apply to Thunder Bay, to Windsor, to Ottawa, to Peterborough, and everywhere in between. But that said, each city and whatnot has unique things happening within it, or different groups that are using the spaces differently. And that's where Matt and I will be able to kind of consult a little bit and make sure that the regulations that were written for the province as a whole make sense specific to your specific setting. Lots of conversations right now around the indoor versus outdoor capacities. Primarily the big takeaway from this one, and we see it a lot with weddings, though we're starting to see it a little bit with the arts community, is that indoors you're allowed to have up to 50 people, and outdoors you're allowed to have up to 100. And I emphasize the up to part because people think that it's just carte blanche. We are allowed to have 50 people in. But the big piece with this one is that everybody that is permitted to an area has to have that 2 meters physical distancing space. So if you're thinking 2 meters in front and 2 meters behind, that's 4 square meters or 43 square feet per person. And what that really speaks to, I think, is that, yes, you're allowed to have up to 50 people. However, that 43 square feet of person space is needed. So if you take an example like an apartment, we're dealing with a lot of landlords right now, an 800 square foot apartment divided by 43 square feet, you could potentially have up to 19 people in that apartment. But then you start adding in things like furniture and appliances and beds and those types of things. And all of a sudden that 50 turns into 19. And then when you start reasonably looking at, you know, the amount of floor space that's available, it's really not that carte blanche 50 across the board. And I know this is one of the things that Emily is going to be working with the province on to see about what that 50 might look like in some of the spaces that could potentially have more than that. So for the purposes of today, with that disclaimer about being accurate as a 130, we're going to work off of the assumption that 50 indoors, 100 outdoors, and those numbers can't be combined. Just some basics, and we'll get into this a little bit more. We talk about cleaning, but it's one of those things that's actually required as well. The piece with this one too is that we're happy to send all of the links and resources that we talk about so that when Gabe and Sue send out the email afterwards, all of the resources that we talk about today will be included. One of the ones here comes from Public Health Ontario, and it basically says that commonly touched or publicly available spaces must be cleaned at least twice a day or when they become visibly soiled. And those are the high touch points, primarily like doorknobs and handrails and bathroom faucets and those types of places, and being done in such a way that Public Health Ontario recommends. And again, we'll send out that resource so that you kind of have an idea of what's required. This one here, especially the fourth or the third bullet point around food. So if you were to have an intermission after one of your shows, wine and cheese can't be served kind of finger food style, or triangle sandwiches or those types of things. Primarily, the food has to be served by one person. We're not having lots of people go into, you know, a coffee station or reaching into a potluck soup kind of food service. And Matt and I can certainly walk through what that might look like if you had questions, if you were in fact serving food at your event. And if they are eating food, they must be seated while they're at the establishment. And again, these come from the province. Matt and I are happy to help interpret the provincial regulations, but these are all provincial regulations. So jumping in a little bit deeper, this inverted triangle is kind of what we look at when we talk about IPAC, or infection prevention and control. And when we look at the blue base at the right-hand side, is really kind of that physical distancing piece. Those are the most effective. Those are what's going to have the biggest impact on keeping people safe. Then we start to look at engineering controls and administrative controls. And at the very end, it's that PPE and hand sanitization and those types of things. So when we're talking about engineering controls, we're thinking about one-way traffic in and out of a venue. We're thinking about, you know, how the venue is going to be set up such that people are going to be able to maintain that physical distancing, what kind of airflow is able to come into the building, those types of things. The administrative pieces, I'm a perfect example right now, as many of you are, working from home, making sure that you've got policies in place to support your staff if they do feel sick or come down with some sort of illness, or how they're able to take time off to support somebody in their family that might come down with an illness. And then again, coming down to those PPE and non-medical mask type things. That's kind of the least effective. And that's not to say that they're not effective. All of these things generally work in concert with each other. That was an artisan joke. You can use that one if you want. But by and large, all of these things work together kind of like a Lego set. We all need to put them together and make sure that we're doing them all at the same time. So getting a little bit more specific. Screening and signage. So there's two different types. The passive screening is indicated on the right hand side, having posters up throughout your facility, maybe doing an email blast, really encouraging people to find out how they're feeling. They can take the online assessment as well. We'll send out the link for that. And this is really just kind of trusting that the person is going to self-identify that, you know what, I'm actually not feeling that good today. Maybe I should stay home, because they haven't thought about whether or not they have a fever or a sore throat or a headache or those types of things. The active screening is where you might have a staff or a volunteer or somebody right at the front of the venue, and you're going through a checklist of sorts to find out if they meet the criteria to be admitted. So we would again leave that pretty much to your discretion as to whether or not you want to do passive screening or active screening. But the list of symptoms is available at this hyperlink. There's an online piece you can do through the Ontario COVID website. And of course, if you do have any questions, we're certainly able to answer those as well. And I think the caveat with this one is that the symptoms are new to you. My wife suffers from allergies, especially this time of year with ragweed and goldenrod. So it's common for her to have a runny nose at this time of year. So that one likely wouldn't be a symptom for her. However, on the flip side, for somebody like myself who generally doesn't have seasonal allergies, I'm certainly going to be paying more attention to those sniffles than I otherwise would have. So that's the benefits of screening and putting the signage throughout the building to make sure that people are aware that they need to stay home if they're not feeling well. One of the things that we often laugh about is, and when laugh is probably the wrong word, but we talk about that the things from the pandemic that are going to get us out of the pandemic are not very complicated. It's easy to become complacent, and it's easy to kind of take things for granted, and it's really easy to think that it doesn't matter anymore because Peterborough's numbers are so low. And I might suggest that Peterborough's numbers are so low is because people have been following the directions and by and large been doing the really, really simple things that we request. Physical distancing is pretty much the #1 thing that we can do. And that's simply because when you're talking or singing or coughing or sneezing, the virus is largely transmitted on those droplets that would come from your mouth or nose. So if we're able to give each other that distance such that we're not coming in contact with those droplets, that's the really, really simple way to make sure that that we're staying healthy. You'll notice too that we call it physical distancing. In the very, very early days of the campaign at the end of March and beginning of April, it was called social distancing. But again, speaking of mental health, we don't want people to be socially distant. We want them to be physically distant. There's ways that people can certainly stay in touch with each other and maintain that contact, which is so vitally important, again, to the mental health side of things, that we really want to stress that this is physical distancing. And then again, there's different signage that's available so that you can remind your guests about those different types of rules. This one really speaks to some of those environmental controls as well, and those engineering controls. If we think about that hierarchy, the big thing is that when you're cleaning, the disinfectant must have a DIN, or a drug identification number. We've had maybe not hundreds, dozens of calls, certainly about people asking, oh, can I use vinegar and water? Or, oh, I've got this, whatever the solution happens to be that they swear by. And by and large, there might be a time and a place for somebody to use a cleaning product in their own home for their own reasons. But when we're talking about public settings, we really need to follow the Public Health Ontario recommendations, which require that the cleaning solution have a drug identification number. And if you flip over the bottle or look at the label, I'm sure you're all familiar with it, or your cleaning staff will be familiar with it. And primarily we're starting at the areas that are the cleanest and then working to the areas that are the dirtiest. Again, getting to the areas that are at least getting cleaned twice a day or more often if they become visibly soiled. Paying special attention to where people are congregating or you know, entering through the use of push buttons or doorknobs and those types of things. And hand washing. Vitally important for at least 15 seconds, if not a little bit longer, with warm soap and water. If soap and water is not available, certainly using hand sanitizer is acceptable. Just to caution though, that hand sanitizer is only effective if somebody's hands are clean. So if you're coming in from the garden and your hands are covered in mud, or you've been doing some work under a car and your hands are greasy, the hand sanitizer won't work unless those hands are clean. So hand washing is primarily the best thing that you can do lots of times throughout the day. And then once your hands are clean, maintaining that with hand sanitizer. And then making sure that all of those things are appropriately monitored to make sure that the cleaning is happening and the hand sanitization stations are available and whatnot. So that really speaks to the environmental cleaning and disinfecting side of things. This one here, again, super simple. Happy birthday, the favorite chorus of one of your favorite songs that you want to sing, or a favorite verse, that you're wetting your hands, you're applying the hand soap, you're lathering them out of the water. One of the things that I used to be guilty of before I started hanging out with Matt was that I would wash my hands under the faucet. Totally ineffective. So you want to make sure that your hands are lathered. You remove them from the water, and then you rinse it off, and then you're turning off the faucet with the paper towel that you dried your hands with. I've seen lots of places that have the receptacle for the discarded paper towel beside the door, such that you can open the doorknob or of the lavatory with that paper towel and then discard it. And then again, having signage posted throughout for washing your hands frequently. We've seen some pretty creative things, and I'm sure that you guys could come up with some neat ones in terms of making sense in your own space. We talk a lot about pinch points when we're talking about physical distancing and some of those engineering controls, and those are those spaces where people are going to be coming in through a doorway or an aisle. And in Nova Scotia, they use lobsters on all of their pieces to talk about the pinch points to avoid. And I think there were some pretty cool ones that the city of Peterborough did using lift locks and canoes and things like that. So there is an opportunity to be creative here for your space, but just reminding people that these are at the very least the bare minimums. And if you're not able to be as creative, we certainly have a page of signage that you can print off to meet your needs as well. This one is a relatively new one, but something that's become the norm pretty near across the province. There have been a variety of ways that this has become implemented. The way that we've chosen to do it in Peterborough is that Dr. Salvatera, who's our medical officer of health, has issued a mandatory face coverings directive. And that directive basically states that if you're on the inside of anywhere except a church or a school, you're required to have a face covering on. When we talk about face coverings, we're talking about something that fits securely between the nose, the mouth, and the chin, and is nice and secure, snug, yet comfortable. And primarily that's for source control. So when we were talking a little bit about that physical distancing piece, one of the things with a face covering is that if I'm wearing a face covering, it's not protecting me from you, but it's rather protecting you from me. So vice versa, if we both have face coverings on, we increase decrease rather the likelihood that those droplets are going to be transmitted, such that we can keep our numbers low. So it's a relatively simple thing to do, but something that certainly would be required in one of your establishments. So we're going to dig a little bit deeper now, getting into section 11 of 364/20. This one, again, we've talked a little bit about already in terms of the 50 if the concert event or performance is indoors and 100 if the concert event or performance is outdoors. And sadly, we can't combine those. If you had an indoor and an outdoor space with a vestibule or a gazebo or something of that nature, it's an either or number as 50 or 100. You can't combine those two numbers. And that speaks to the spectators. This number does not include the people that would be on the stage or working the lights or otherwise involved with the performance. This really speaks to the number of spectators that are coming into the venue. Singers and players of brass or wood instruments must be separated from spectators by plexiglass or some other impermeable barrier. This one is largely because when you're singing, you're projecting, and when you're playing brass or wind, you're primarily blowing. I don't have to explain that to you. I'm sure everybody on the call is much better expert than I am. And how this is done is really up to the organization and the agency. We've heard some really cool things where people have created, 2x4 frames and have been using dollar store shower curtains. And then we've heard of a lot of people that have been doing the plexiglass piece as well. So as long as there's a barrier between the audience and the spectators, or rather the spectators and the performers, you should be good to go. The caveats here, obviously, is that if you are on stage and part of an ensemble or a theater guild or what have you, you are able to breach that physical distance piece. And that's where the physical distance piece must be maintained, except if it's necessary for the performance or the rehearsal. So there is the caveat that you are able to get close. We're still asking people to be respectful of that space and try their best not to spit and put droplets on each other. But certainly Matt's not going to be out with his ticket book if he sees people on stage that are breaching that 2 meters. There is obviously that caveat. And then likewise for the facility to operate in terms of admission or food or beverage, though I heard Emily talking about a new online system, which is great. So if there's different technologies that you're able to employ, that's fantastic. And then obviously where health and safety comes into play, we'll worry about the physical distancing and the COVID afterwards. But if there's a fire drill or an earthquake or whatever the natural disaster might be, and people's health and safety are at play, obviously that physical distancing becomes secondary to people's otherwise well-being. But you don't have to do it all by yourself. The regulations are fairly complicated and wordy and full of words that mean different things. And we've learned that there's lots of nuances between you should do this and you must do this, or we recommend that you do this, or you have to do this. So to make it a little bit easier, we've got 3 documents for you, and we'll send you the links for these as well with the package on the end. The first one really speaks to a workplace as a whole, or a gathering space or a venue that you might have. And it really takes the regulations and kind of splits it into a checklist of sorts. So when you think of the hierarchy of control that we talked about, that's basically what this 15-page document is, and it will walk you through a section. Have you thought about personal protective equipment? Have you thought about policies to keep people at home? What are you doing with the physical space and those types of things? So it's really the much larger document to start thinking through what the space as a whole will be. The second document is kind of a synthesis of that, and it really boils it down into some of those other things that we talked about today in terms of the capacity limits and the signage and the screening. So it really speaks to the first part of the presentation, but we've turned it into a checklist. Have you done this? Yes. And if not, then here are the resources on the right-hand side that you can go to so that you can either print those off or have access to the provincial or local regulations. And then the last one that we have, depending on the space that you're working out of, it's really designed for community and recreation centers, the activity havens of the world, but we certainly recognize that a lot of these spaces that you guys might be working out of might be some of those community centers, or might be some of those church spaces, or might be some of those other event spaces that aren't some of the more traditional ones. So it kind of walks you through kind of the bare minimums as well. So this is kind of that inverted triangle approach as well, where the one on the left, the safely reopening document, speaks to everything as a whole. Then you kind of get to what does it all mean in my specific setting? It might be for a pop-up event or a one-time event that you would walk through that event in the middle. And then lastly, what does the actual space look like? So there are a series of documents that we've created to help you sort through what all the regulations mean and how to bring them to life in your space. And I think we're going to skip this part on the questions because I believe Emily's going to be chatting next, and then we'll open it up to questions after that. And again, just that Matt and I are here to help as you're creating your plans and your reopening ideas and things like that. We're certainly happy to go through what the policies and processes and protocols that you come up with. We're certainly happy to review those and put some suggestions as to what you might want to think about if you haven't thought about it already. And we'll be sure to share our contact info with you as well. So with all of that said, Gabe, I'm going to turn it back over to you.
Okay. Thank you so much. That was really interesting and very useful. So yeah, I think we will now pass things over to Emily Martin from Showplace and from the Peterborough Performing Arts Recovery Alliance. and to talk a little bit about the work that they're doing and how this is starting to be applied in town.
Hi, Gabe.
To you.
Gabe? Yeah. Sorry, it's Sue. I just wanted to say something before Emily starts out. This webinar was organized and designed for all arts organizations in Peterborough, but with a particular eye to the performing arts, because those venues are facing very specific challenges. EC3 was really fortunate to have Gabe do a lot of research on reopening protocols and relaunch protocols. We've issued a huge bulletin on that that's available on our website, but it's really Emily and the crew in the Performing Arts Recovery Alliance who's brought it home and have been working on a local guide. And that's what Emily is going to talk about today. Thanks. Emily.
Thanks, Sue. Yeah, we, as the Alliance, we kind of decided that it'd be a really good idea if there was something, because there's so many different reopening guidelines out there right now. So we really kind of sat as a small subgroup. So there's myself and Chad from Market Hall, Katya from the venue, Joe Reese, who's the chair of Market Hall and also a lawyer with LLF, Fred from St. James, and Sarah from Fourth Line. So we sat down as venues, whether you're volunteer driven, whether you're for-profit, non-profit, whatever, to develop some kind of guide that we can all use, because we share so many of the same patrons among a lot of our organizations to begin with, so that patrons really in Peterborough know that we're all following the same basic ideas. So we've really developed this guide. So version 1 is done. So we've just sent it out as a group. We're sending it out to just people within our organizations, like our volunteer team leaders. Looked at ours the other night, which is why it's not ready for today, because there's a few tweaks that they've come up with, and but it'll be ready to go within probably the next 2 weeks. We've really split it apart. We've taken all the reopening guides that we can see, especially from the Performing Arts Consortium, which is a North American guide, the Event Safety Alliance, IATSE, they all kind of have their own reopening things. So we kind of looked at everything and took the best of. And we've split it between front of house, back of house, and administrative areas. And we have also submitted that to Keith to take a look at. So Keith, if you want to share that with your colleagues as well and let us know if there's anything there that needs to be changed. And then we'll be ready to share that information. And Keith also, when I was talking to Keith before the webinar, was around the idea of the numbers that we're allowed to have. So when he talks about doing some advocacy, if we can have more than 50 people safely, he's going to share a link with Sue and I about how to apply for an exemption to that rule, because I know at Showplace, for example, we have a lot of space, so we could potentially have more than 50 people. And also around the plexiglass barrier as well, because I know in New Brunswick, they're running that as long as you can have 12 feet between the artist and the audience, you don't need the plexiglass barrier. And that's a huge, financially, that's a huge undertaking for us. So that's something that I'll be working on as well. But we will have that information ready to share very, very shortly. And it's very exciting and positive, and some way to look forward in this whole mess as we, very teasingly get told 50 and then, no, we're going to pull that back a little bit. And then, no, you can do this. So we were the first closed, we'll be the last ones reopen, but we want to make sure that we're ready to go as soon as we can possibly welcome people back in.
Perfect. And we just want to thank you for that work that you're doing as well. And a lot of the work that we've been doing with municipalities has been so that people that are at an arena in Apsley have the same experience as they do in Millbrook, so that your team has put so much effort into making sure that you have the same experience with whatever art event that it is that you're participating in is only going to benefit not only yourselves as organizers, but also the patrons that are coming to enjoy the show and the music and the festivities as well. So kudos to that.
Fantastic. So I think we'll now open it up to some questions. I've got a couple questions that were asked by email, so we'll start with that. But if anyone has any questions, please drop them in chat and we'll get to them in the order that they're in chat, which seems like a fair way to do it. But we'll start. Bill Kimball from Public Energy sent over 2 questions, actually. So I'll ask both of those. I'll ask both of them, and they can answer them in whatever order you'd like. The first question is, if we require audiences to wear masks, is it necessary to keep them all 6 feet apart? So do you need both? And then the second, we'll have staff meeting audiences and checking them in, getting contact information for tracing, and telling them where to stand or sit. For accessibility to deaf people, being able to read lips is very important. So we want our staff to be able to wear face shields. Is that acceptable? I've heard that clear face masks exist, but we have not been able to find a source for them. So a question about face shields and a question about masks and 6 feet apart.
Let me just add an addendum to that. Those are for outdoor events I'm talking about. It's a little different.
So
I know everything else here is an indoor event, but I'm sort of curious about outdoor.
Yeah, no, that's a great question. I'm going to defer the masks and the 6 feet and the outdoor piece to Matt. But to answer your question about the face shields versus face masks, so I guess the long answer short, or the short answer long, is that our directive only applies to the indoor settings right now. And this is where we start talking a lot about the nuances about, thou must or thou should or we really recommend. So while it's not required as part of the directive for outdoor things, we really recommend that face coverings are worn. With regards to the face shields versus the face mask, there is an exemption in the directive such that if there was a different ability that somebody would need to have the ability to read lips or was hard of hearing, a face covering would not be required. In broad strokes, though, a face covering is meant to be worn in conjunction with a face shield, not instead of a face shield. So the analogy that I often use is similar to a seatbelt in a car is only as effective as the airbag and vice versa. You need both of them to have a safe driving experience. So notwithstanding, obviously, the exemption for hard of hearing or reading lips, or that indoor versus outdoor piece, by and large, they're meant to be used with each other, not instead of each other. And then with regards to the distance and 6 feet, Matt, who's on mute.
And sorry, so what was the question with the 6 feet again? Wearing a mask, and do you still need to be 6 feet away?
Yeah, do you need both to do both? Yeah.
Yeah, ideally that's in an outdoor setting, ideally, yes. And it's the same thing with indoors too, like the masks aren't perfect. They're not medical masks that we're wearing most of the time. So it's to be used in conjunction with physical distancing.
Okay, perfect. Thank you. We've got some questions popping up in chat from Emily Martin from Showplace. One question their volunteer team leaders asked the other night was around mask exemptions. Will patrons have some kind of card from their doctor? Oops, chat just moved. If they're exempt.
So the directive does not require any sort of exemption beyond somebody identifying that they have an exemption. So at this point in the pandemic, we're seeing most of the time we're seeing compliance, which is great. But if somebody has asthma or COPD or some other reason that they're not able to wear a mask, they don't need to prove it. We don't want people clogging up doctors' offices asking for doctor's notes. We trust that people are going to be able to make an informed decision based on their own health. Such that they'll hopefully maintain that physical distance if they're not able to wear a face covering. So the short answer is no, they don't need to prove that they have an exemption. And in fact, we're asking that that if they say they have an exemption, that's where the conversation ends. We're enforcing this right now in good faith, and we're hoping that establishments will just do everything they can to encourage people to wear a face covering or remind people that enter the venue that the face covering is required. But if they identify that they have an exemption, welcome them to the facility and on your way.
Okay, perfect. Some more questions from Sue. I guess the other side of the question, if people are wearing masks, can they be closer together?
Outdoors.
Outdoors.
So the short answer, I think, and Matt, maybe you just want to keep yourself off mute because this is all your bailiwick. So you got the question?
Yeah. So yeah, and masks, and this is one thing I've been noticing when I'm out doing inspections is that, and I kind of feel the same way too. Sometimes I have to catch myself, but you have a mask on and you suddenly feel like you can be talking 1 foot away from the next person. And masks are really meant to be used in conjunction with that physical distance of 6 feet, because the physical distance of 6 feet is not perfect and face coverings aren't perfect. The hope is 2 of them together are pretty good. So in the outdoor, we wouldn't be able to enforce anything other than recommendations, but it would still be recommended outdoors to maintain the 6 feet and be wearing a face covering.
That makes sense. Next question. Do singers need to have a barrier if they're more than 20 feet from the audience and if it's an outdoor performance?
That's a really good question. And so right now, the regulation, and Keith, correct me if I'm wrong, but it doesn't differentiate between indoor or outdoor when it comes to performances. And it just mentions the plexiglass or some other impermeable barrier, specifically for singers or wind instruments. But what you're saying does make sense with the 20 feet or the 12 feet, like I forget where they're doing it. But something like that does make sense. We could look into to see if we could do anything about that. But it would probably be like Keith mentioned, since these aren't local rules, these are provincial rules, that would probably need to go to the Chief Medical Officer of Health to see if we can just get an exemption. Okay. Does that make sense, Keith?
I think so, yeah, and I think that this kind of speaks back to that point that the province has indicated that they're not ready to start making easements quite yet as everything starts to open up. I think they're hoping that September and October will have a bit of a plateau or a collective catch our breath, and then we could certainly entertain some of those questions. But I think just the way that the regulations are written right now, a barrier would be required. Not that 20 feet isn't sufficient, but kind of the letter of the law approach right now.
Okay. Next question. My question pertains to outdoor venues, and I'm frozen, so don't ignore that. My question pertains to outdoor venues. All things being equal, is there any truth to the widely believed notion that outdoor gatherings are safer than those held indoors because of the simple fact they're held outdoors and not in a confined space? So are outdoor gatherings inherently safer?
So never a black and white answer when it comes to the stuff that Matt and I have to say. The short answer is yes, outdoors is generally safer than indoors. We're seeing a lot of the schools moving their students outdoors for outdoor education right now and taking stumps and tables and things like that to get these kids back to school safely. By and large, I think the short answer is yes, but they're not safe just by being outdoors. They're safe when we're physically distanced. They're safe when we're washing our hands and wearing face coverings. So definitely safer, but not foolproof.
Yeah, and just to add to that too, especially indoors at this time of year, when you start seeing a rise in cold and flu, part of the reason is that the air is so dry, it's very easy for droplets to travel a far ways. So there is some benefits to holding these events outdoors, but it's not a 100% type thing.
Okay. Next question, following up on the discussion of people who are unable to wear face coverings or who state that they are you allowed to deny people entry if they can't wear a face covering?
So the short answer is yes, you could. This would fall under the Trespass to Property Act, and it becomes a far more complicated adventure than just admitting somebody. By and large, these places are private property, so the landlord or service provider would be able to come up with their own rules. But again, getting back to the spirit of the directive and what our intent and hopes are through what we're asking people to do is that they're not going to refuse service to somebody for simply not having a face covering. There's a whole host of reasons that somebody might not be wearing a face covering, economic reasons, social reasons, health reasons, and so on and so forth. So yes, in many ways you could. However, we're really, really encouraging you not to.
Okay. Next question is from Kim Blackwell from Fourth Line Theatre. I'm looking for some direction on plexi barriers as Fourth Line is part of the Open Spaces Theatre Festival, September 24th to 27th, and our Halloween play at Fourth Line, October 20th to 30th. What is the minimum size for barriers for singers, and how can we apply for an exemption to barriers for singers? if we can't be more than 12 feet away from the audience and other performers. And this would be an outdoor question as well, because of fourth line.
Matt?
Yeah, and I will just say there's nothing, I think maybe it's New Brunswick. It sounds like they've maybe allowed at that provincial level to have the 12 feet thing. As Keith mentioned, we don't have that here. All we have to go by is the legislation, and I've spoken with Kim before. That's really all that we have to go by, and it just says there needs to be a plexiglass or some other impermeable barrier, so it's not very specific. So we could look at your specific venue and try to determine what would make the most sense.
And it certainly sounds like that exemption question is being asked a lot, so we'll make sure we include that application piece in the materials that we send out this afternoon.
Absolutely. Next question comes from John Topic, looking for clarification. Our understanding was that we would have players wear masks except when seated and actually playing instruments. This is for practices with no spectators. So does that work?
Is this New Horizons?
Where is John?
Yes, yes, it's New Horizons.
Yes, yeah.
Okay. Emily Martin asks, is the province planning on making any specific HVAC requirements for performing arts centers? Is there a specific space that we should look for this?
So what I've been able to read about HVAC is that if you're able to open your windows, that's awesome. Fresh air, introducing fresh air into the place, that's great. But I understand that it's Peterborough in February that we might be talking about. But with regards to specific HVAC requirements, again, we can send some of the information that we have from Public Health Ontario, but by and large, existing systems are sufficient. And Matt, correct me if I'm wrong, but from what I understand is that if droplets are caught in those systems, that they would often most likely just stick to the ductwork or filters or what happens to be in place. Obviously, HEPA filters are better than not, but I don't think that we're looking at asking places to start upgrading their HVAC.
No, and this just came up with another place recently, and you just need to make sure that your HVAC system is regularly serviced. So if it hasn't had somebody come in and check it out for a couple of years, this would be a good time to call and just say, are the filters all up to date? Do we need to change anything? But yeah, no special requirements that I've heard of coming down the line.
Okay, great. Next question is from the St. James Players, and Fred there. St. James Players will be performing in a church setting. So will the 30% capacity requirement for churches apply, or will the 50 spectators for indoors apply?
And I believe that one would be, my understanding, and jump in, Matt, and tell me that I'm wrong. It only happened 7 times today. Let's go for 8. But my understanding is that with religious settings and church services, that it's 30% capacity only applies to the church service, not if the place is being used for another piece. And the reason for that is because there's a separate guidance documents on things that can and can't happen during a church service that would subsequently protect people more so than just the 50. It'd be one of those ones, again, looking at the exemption piece and potentially applying some of the rules that would apply at a church setting to increase that 50. But the churches have a separate guidance document that has allowed them to have that 30% capacity versus other places. Yeah, Matt,
that's my understanding as well. Yep.
Perfect.
All right.
We're going to keep it at 7 times wrong today.
Okay. There's no more questions in the chat. Does anyone else have any questions? Either throw it in the chat or just yell it out at this point.
Gabe, I have a question. I'm wondering if the public health folks know anything or can provide any guidance on sourcing some of the equipment that organizations need to meet the regulations, including plexiglass. I see you have some printable signage, but there's a lot of demand, and I understand that there's starting to be a shortage of plexiglass. Do you have any information or updates on that?
I do, and I'm going to speak for Joe. I know a lot of his colleagues at the Peterborough Chamber and the Kawartha Chamber have a PPE portal is what they're calling it. So right on their website, and I'll include that link when we send it out. It has all of the folks locally that are making, manufacturing, and distributing a lot of this stuff. That would be my first recommendation for so many reasons, to start there. And then failing that, you'd have to expand your searches, whether it was online or at some of the big box stores. But I know that the Chambers of Commerce have done a really good job of putting all that information together for us. And I believe, if I remember the website, they've got one section that's PPE, one section that's physical barriers, one section that's signage, and so on and so forth. So there's lots of local folks that have retooled their work to make sure that that's available locally.
Thank you.
Did I get it, Joe? I got a thumbs up, so we'll take that as perfect.
All right.
It's available on the Economic Development website and the Peterborough Chamber of Commerce and the Kawartha Chamber of Commerce websites. Each have a section for PPE suppliers.
Great.
Okay, is there any other questions? I'm hearing silence.
So I've got a question for the group, and this is totally selfish, but one of the things at Public Health, we do a lot of work in the background, and quite often you don't often see what we're doing. So what I would love to do would take a screen cap of this, just so that we can kind of document kind of the work that we're doing. But obviously that comes with people having their faces and names out there. So if you're okay with that, perhaps you could turn your screen on. And if you're not okay with that, you could turn your screen off, or we could just pretend I didn't ask. But I would just love to be able to share with the community as a whole, perhaps through Twitter or our own team, that, oh, Paul's fixing his hair, good. But if you're okay with that, and hearing no objections, I might just hit the print screen button and, oh, everybody, maybe we'll smile. Ready? Smile, 1, 2, 3. Perfect. We'll see if that worked, and if not, then that's okay too. Thank you though for humoring me.
Thanks, Matt. I think we can probably wrap things up. We did really well on time. It's only 1 minute after 2, and that's a huge accomplishment in itself and speaks to your professionalism. Many, many thanks to the folks at Peterborough Public Health. They've been fantastic from beginning to end. Thanks to Emily Martin and all the folks in the Performing Arts Recovery group. Special thanks to our team, Gabe Pollock. And I'd also just like to give a shout out to Keith Riel. Councillor Keith Riel from Ashburnham holds the Arts, Culture and Heritage portfolio at the city and chairs the Arts, Culture and Heritage Advisory Committee. And he's the one that helped us make contact with the folks at Peterborough Public Health. We'll be following up on this webinar in a wide variety of ways. We'll keep posting information on reopening, and we'll disseminate the guide when it's ready. And please like our Facebook page, follow us on Twitter and Instagram. And I would just want to say that I know all of this is incredibly overwhelming, and I want to thank all of the organizations in the arts, culture, and heritage community who are carrying on despite the odds with incredible creativity and tenacity and imagination. It's an honor to work with all of you. We wish you the best of luck. Get in touch if you need anything. And good luck, everybody. Take care of yourselves. Stay safe.
Perfect. Thanks so much for having us, everybody.
Thank you.
Thanks so much. Thanks, Keith. Thanks, Sue.